Hello, my name is Dr. Carlo Carandang. I'm a psychiatrist and I'm here to answer your anxiety questions today. We have a question from Gene, who hails from San Francisco, and he asks if I can give an overview of anxiety. Anxiety disorders are characterized by extreme fear, nervousness, or worry on exposure to a feared stimulus. The feared stimulus can be an object, person, or situation. Now there's a difference between fear and anxiety. Fear is a reaction to a current stimulus, whereas anxiety is fear of some future stimulus or anticipation of one. Anxiety becomes a problem when one becomes fearful, nervous, or worried out of proportion to the feared stimulus, or becomes nervous or worried about some future stimulus or anticipated event. Fear is needed for survival. Fear is a normal response, and it is a necessary component of survival. When you are presented with a danger, there is a physiological reaction which is triggered with subsequent release of adrenaline into the bloodstream. Adrenaline is a fear response hormone, and adrenaline causes several physical changes in the body, including increased heart rate, increased rate of breathing, and dilated pupils. Also, when adrenaline is released, this causes a shunting of the blood flow from the digestive system and the skin to the skeletal muscles. So what this does is that it can cause butterflies in the stomach and can also cause numbness and tingling sensations of the extremities. So this is known as the fight or flight response. These physical changes with the adrenaline release allows the person to prepare to fight the danger or to run from it. Again, this is called the fight or flight response. So why all the physical changes with adrenaline release? Well, adrenaline causes an increase heart rate and breathing, which allows the blood to supply more oxygen to the skeletal muscles needed to fight or run. Blood is shunted to the skeletal muscles, which further aids the process to either fight or run. Also, adrenaline causes the pupils to dilate, so this improves vision so that you can assess the danger more adequately. Also, adrenaline causes the brain to become more alert and hypervigilant for danger, allowing one to scan their environment in order to deal with the external danger. Anxiety is basically fear gone wild. The fear response goes awry and turns into anxiety when you start to anticipate the danger, you overestimate the danger, and you underestimate your ability to cope with the danger. So basically, it's not the event that leads to anxiety, it's your thoughts about the event which leads to anxiety. The fear response is heightened by your thoughts about the event or future event, and your thoughts of anticipatory worry, overestimation of the danger, and underestimation of your coping leads to the anxiety. So with regards to adrenaline and anxiety, the body perceives fear and anxiety the same way. So adrenaline is released and triggered with either fear or anxiety. So basically, abnormal anxiety serves no purpose. Anxiety activates the fight or flight response. It serves no purpose as the danger is more in your head rather than externally. And your thoughts about the situation leads to anxiety. Anxiety becomes a disorder when the anxiety symptoms cause impairment of functioning in your relationships in work and school. And also, you have significant distress and are unable to control the anxiety. The major anxiety disorders include generalized anxiety disorder, specific phobia, social phobia, panic disorder, post-traumatic stress disorder, and obsessive compulsive disorder. For more information on anxiety, please visit AnxietyBoss.com. I hope this answers your questions, and thank you for viewing and listening.